Thank you all for joining us today for part 2 of our Educating Business Leaders series, where we will focus on mental health, emotional impact on families dealing with childcare related concerns and issues. I have 2 amazing women joining me today to discuss the topic of mental health and the impact on families. Here with me today, I have Dr. Treva Bostic, who currently serves as the Director of Race, Equity, and Inclusion for Anderson Community Schools. In this capacity, she works with teachers, administrators, students, parents, and community members in Anderson, Indiana, to ensure that students of all backgrounds have equal access to quality education. I also have Susan Day, who is the director of the Indiana University Employee Assistance Program. She oversees the programming for IU Health and a variety of other Indiana companies. Susan has served in clinical and leadership roles for over 35 years in both hospital and mental health settings. She is a member of EAPA International and the local Indiana chapter, where she has served as president-elect and president over several years. Thank you, ladies, for joining me.
Thank you.
Thank you.
All right, so let's dive on in. So mental health issues have been on the rise in the United States for several years now. Globally, symptoms of anxiety and depression doubled during the pandemic, and I think we all can attest to that. About 63% of Americans are a part of the U.S. labor force. It is increasingly recognized that the mental health of employees is crucial and detrimental in the overall health. With that being said, we can dive into our questions. So for the both of you guys, what are the signs that employers should be aware of in the workplace regarding their employees' mental health?
Do you want me to take a stab at that, Treva?
Yes, go ahead.
All right. Well, I'm so grateful that you're doing this session, because I really do believe that education is key in this arena. And I do think we're being re-educated as the pandemic has rolled out and created new spaces and new issues for us to address. So I think the first sign for change is becoming aware. So I think from the standpoint of employers and employees, we really need to continue to become aware of issues on both sides of the coin. So that's the first, I think, step towards change is education and awareness. And I think some of the awareness is around all the impacts that we'll talk about today, the financial impacts on families, the diverse needs of families, and the type of childcare that they need, the ages of the kids, the timeframes of the family. There are so many families juggling so many different kid needs, all different kind of needs for childcare, school, getting them on the bus, getting to work on time. And what we find at IU Health often with employees is that daycare may not correlate to the schedules of the employee, because so many, IU Health is a 24/7 entity. It's its own kind of little world. So the 12-hour shifts might be unique and not line up with the child care provider shifts. So that creates more impact on the family trying to get the children picked up at the right time, or maybe have to drive further to a provider who does have open hours later. So there's all kinds of issues there that really impact work-life balance for employees overall. So I will leave it at that for the moment and see if there's more there to add, Treva.
And if I could add to that, especially coming from the education industry, this pandemic, especially, for single parents, have put them back almost 25 years. In the educational setting, we can close school now if there's exposure to COVID in the classroom. We can notify parents that day that their children cannot come to school for 7 to 10 days because they're quarantined, which causes a great issue for parents trying to find childcare. We don't have a lot of places that have childcare set up for a child that's 10 years old, let's say, or 11, and they cannot be left at home. So it's requiring employers to either be flexible with their staff, or what's happening is a lot of individuals just are having to quit their jobs because they have to be at take care of their children. And this is going on throughout the country.
I agree. I like both of the things you all said. Education, awareness, and flexibility is where we have to start when it comes to the employer. With that being said, I know you took a stab at you mentioned single parents. So juggling caregiving with work has never been easy. I don't think for a single parent household or even a 2-parent household. So what can employers and employees do to help reduce physical and emotional stress in that type of setting?
Well, I'm just thinking that flexibility is so key, and adjusting schedules to work with employees. Sometimes an employee might be able to work shifts in a different cadence during the week. Maybe they work a couple of days on and then a couple of days off. Maybe that correlates with a partner, a spouse, their schedule, that type of thing. But I think having the conversation with your managers and leaders needs to take place, because otherwise the employer doesn't know that there is a need for that kind of flexibility and maybe make some assumptions that the schedule's just fine. And some people, I think, are reluctant to ask for those kind of things. And I think asking for what you need is so key. We'll talk a little bit later, I think, about women. And I think that's one issue for women, oftentimes not asking for what they need, or thinking somebody might know what they need already, when we do have to be clear and direct in terms of asking for what those needs are. I think that the emotional and the physical stress that people are dealing with is so compounded by these extra layers. So the last couple of years, we see employees that are struggling with issues related to the adverse effects of the pandemic in our own healthcare system. And then on top of that, they're juggling all these things outside of work that are just piling up, and it creates all these layers of stress and opportunity for poor well-being. So also, I think being aware from the employer standpoint to provide resources for well-being. Certainly giving people the opportunity for an employee assistance program, giving people time to use the services. We have chaplains here. We have kind of a wellness program that's awesome, and people can often learn ways to balance their stress more favorably to their needs. So there's so much, I think, that can be done, and hopefully we are doing that as employers. We're stepping up to the plate as much as we can. And then I think on the employee side, although the stress exists, we all have some personal responsibility to take intentional action towards our own well-being. Nobody can do that for us. And we have to be aware of that. We need to find some ways to learn how to breathe through our days, for instance, learn how to get up from a stressful situation and say, I just need a quick break here. Take a walk in the evening, do something, dance in your living room, whatever it is. We need to find ways to reduce that stress significantly throughout the course of each day, or it just keeps piling up. And that's where we end up with residual health effects, people getting sick, and even little sicknesses can really be a setback for people. So I think that addresses that a little bit, but I'd love to hear more from Treva.
Susan, I'm going to piggyback on some of the things you talked about. First of all, I think it's important for employers to have, being able to talk to a counselor. I know we have available even 24/7 where we can talk to a doctor or a counselor. And being a psychologist, I appreciate that our organization was very proactive in getting that, especially, and this is new for our organization for the past year since COVID hit, not being able to be accessible, getting into doctor's office. I can contact someone right now if I wanted to talk to a therapist. We even have it available in our school system for all students as well, because they are dealing with a lot as well, being out of school and then coming to an environment where we're constantly wearing masks, we're quarantining, they're losing teachers, they're losing family members. I also want to add for employers to try to help their staff to be positive during all of this. And as Susan talked about, being able to relax. I think it's important for staff members to prioritize, try not to be superwoman or superman. Especially as women, sometimes we tend to do that, not say no, and we get overworked. And stress causes, when we're overworked and stressed, that causes health problems. And I think we need to do a better job at that, of allowing our staff to work through some of these issues without being penalized.
Absolutely. And I'll piggyback on you now. I think that building your own support system is really key too, because a lot of times, as you mentioned, being superheroes, super moms, super people, we just have to give ourselves a break and be able to say, I'm doing the best that I can right now, or I will ask for someone to help me do better the next time or in this situation. But support systems are so powerful to us, our external support system, as well as our work support system. We need to have people we can talk things over with. I often recommend to people, have a venting partner. It only takes maybe 10 to 20 seconds to say, this has been a really, really difficult situation, or I feel really sad about this situation, or I wish I could take a break right now, but I can't. Whatever it is you need to say, sometimes just saying it out loud can make it more real and more manageable. I think that it's also important for women, especially, but all caregivers, to find support systems that maybe it's a group support system, maybe it's a Facebook group, maybe it's some way to engage and find answers and ask questions, be understood, and to understand others. And I always think too that it's important for people, for their own well-being, to create a backup plan to the backup plan. People are naturally more organized. Things come together for them easier, and they may organize that way. But I think sometimes when we're not maybe inclined that way, to make sure you've got a next step. If this doesn't work for your childcare needs or for your personal situation right now, who are those go-tos, and who then backs up those go-tos if they get sick or if they aren't available? I think that if a job can create that flexibility, that's ideal. In some jobs, it's hard to do that. Maybe the shifts just don't really work that well. And sometimes it takes finding a different job, perhaps, seeking another way to deliver your expertise in a different environment, perhaps, if that's a need. And I think the self-care basics are all there. Again, I know we're continually teaching, different self-care tips. And I think we'll talk about that a little bit later. How do we keep people well? But just wanted to note that that's another big piece of it. Again, that intentional, purposeful decision on each of our parts to say, what can I do to help myself stay as well as possible, is also very key.
Thank you, guys. So definitely, I think that businesses and employers and employees need to realize, at the end of the day, childcare just isn't a family issue, but it's also a business issue too. And I think that the pandemic has heightened that need. It's made it more aware, and it's also strengthened the need of, okay, I need to draw these employees in. How do I keep them here? What do I need to do? Do I need to gain that flexibility in my schedule? Do I need to survey my employees to see, hey, what is your need? What can I do to help? And I think having an employer that actually understands that need goes a long way. So with that being said, I'll jump right into the next question. So we know that the brunt of childcare demands fall on women. Therefore, what can we do to strengthen their mental health and emotional stability, as well as men too?
I think there's a lot from an employee standpoint. I know IU Health is probably, and this is a guess, but about 80% female as far as the workforce. And I think we have affinity groups. We have affinity groups for women, affinity groups we've had for diverse cultures. We've had affinity groups for LGBTQ. So we have a lot of broad-based opportunities, I think, but they also then have to be given the time to avail themselves of participation, right? So that's always something that is a particular need. I think for women in particular, a lot of things we've talked about, that women do tend to carry the brunt of a lot of these issues. I'm not saying men don't, but I do think it falls on women oftentimes. I think key in this area for women, for their own mental and emotional stability, I think, and men too, is again, those basics with self-care. Just think about movement every day, whatever that movement is. I like to think of people putting on a piece of music and dancing in the living room. I know early on in the pandemic, a friend of mine sent me a copy of James Brown, Get Up Off of That Thing, and that's great music to move to. If you haven't heard that piece, pull it up. It's fun. But those kind of things, some yoga, some stretches, getting out for a 5 to 10 minute walk, looking at nature, being aware that nature is there and it's consistent. We need things that are consistent in our life right now. And there aren't a lot of things that stay consistent. So those people you can depend upon that are consistent for you, your job, your colleagues, finding ways to engage in life in something you can do routinely. Reading, watching a movie can be helpful. Seeking support and direction. Treva mentioned their counseling services, but counselors, pastoral services, in your church, perhaps. I think any kind of external kind of support system through a mental health agency can be helpful too, although I know wait times are very long. In our EAP, we're available 24/7, but we for urgent cares as well. And I think that, we try to offer something within 48 hours, business hours. And that's if somebody wants to have a scheduled time, or they can talk to a counselor in the moment. So, trying to create that kind of flexibility for employees and for self-care for both men and women. And then I think taking things off of your plate that are no longer necessary. So many times we're doing things for the sake of, because we've always done them that way. But we sometimes need to analyze and say, maybe I don't need to do that. Maybe I don't need that pressure right now. Finding ways that we can tap into our creativity, trying something new, even if it's something small, a new class, maybe it's music, maybe finding new ways to socialize. We know sleep is the basis for all of our well-being, right? So adequate sleep. And when you are parents, and maybe sometimes you're not only parenting, you might have other kids in your home. You might be caring for nieces and nephews. You might be caring for an elderly parents or a child who's got a disability or healthcare needs, there's so many factors into this. And just finding little ways that you can reach out for yourself and get some adequate sleep can be helpful too. I don't have all those solutions in that area, but we know people are having trouble falling asleep, waking up in the middle of the night, waking up early, getting 5 to 6 hours of sleep, which is not usually adequate. And then we also see people tipping over the other side. They're sleeping too much and they're getting depressed. They're so trauma impacted. They're burned out. Their compassion is being impacted. So we have to be aware of those kind of things and then do little things to tweak along the way. Breathing, meditation. I'm an advocate of meditation, prayer, finding some downtime just to do nothing can be significant, even if it's 10 or 15 minutes. Pay attention to your budget. Again, there's all these dimensions of well-being, right? And we can't balance all of them equally at the same time. That's where I think it comes to be a challenge for us. But we can try to impact a lot of those areas of well-being simultaneously, just by awareness and doing these simple little things. I talk to IU Health team members about Many times just our own comfort needs, our needs for a bio break, for instance, we don't take that because we're so inclined to take care of the patient first. And that's absolutely admirable, but we've increased our stress. We've significantly increased our stress when we're thinking, oh gosh, I've got to stop here and I need to do this, but I can't right now. If we can just get in the mood or the attitude of, you know what, I'm walking by a ladies' room, I'll just stop in and take care of that need now, whether I have a need or not, because I may not get to it later. But that takes off some stress because you've already decreased the stress in the moment. I think the other thing that is so important too is to look for areas to avoid. I've practiced in the addictions arena for many years as well. And, I think sometimes we self-medicate with all kinds of things. We self-medicate with food, we self-medicate with alcohol, we self-medicate with substances, that might help us calm down. We may overdo some kind of prescribed medication. I think we need to be very aware and avoid those kind of things because they only impact more what we're trying to cope with. They don't help. Alcohol is a depressant. Prescribed drugs should be used only for the purpose they're prescribed for and for the person they're prescribed to. Street drugs, et cetera, of course, going unstated are very dangerous and powerful. And the other thing I like to use is an acronym called CATS. Whenever we find we're consuming too much caffeine, too much, the A stands for alcohol, but it also could mean other chemicals. And then T, tobacco. Tobacco is alive and well in Indiana and being used significantly. But then the S stands for sugar. So those components rev up your stress response and they key you up for anxiety. So when you pay attention to them and be sure that you are staying away from things that aren't helpful for you, you can reduce your anxiety significantly. So pumping up with 3 gallons of coffee and 10 Danishes in the morning is not the best way to start the day, right? Not that we're doing that, but just saying. And finally, I just want to add, I think women tend to not create significant boundaries in their lives at times. They're caretakers. Women are trained, in the 1950s, we began to emerge in the workforce even stronger, but we still are acting sometimes like we're in the 1950s, that we have to care for everyone all of the time, 24/7. And that can have some powerful blessings and good impacts, but it can really be depleting. So keeping boundaries. The other thing women, I think, tend to do, and again, I'm speaking to women primarily here, but can it relate to others, overthinking situations, overanalyzing, over worry. We create our own stress in those moments, and that can be taught, or things can be taught to help people manage that. So reach out for that kind of help. And then holding in your grief and other feelings. A lot of times people think, oh, that's not that important, or my needs aren't that important, or absolutely they are important. But holding them in or denying the feelings that you have, even if you journal about them, or if you, again, have a venting partner or somebody who you trust, you can share feelings with, can be very powerful. It removes it and puts it outside of yourself to look at it more objectively. So those are just some of the things I hope we can avoid too, holding back those feelings, overthinking too much. But there's help out there to help us learn how to do those things as well. So thank you.
Susan, you talked about a lot of key things that I think is very important. Something that really stuck to me was about the caretaker of the women, and culturally, sometimes in some cultures, that's just what we do. We have to take care of other family members because that village concept. And so that's going to be hard to change for a lot of people. And that's going to take a lot of time trying to do that. As far as, the boundaries, with the family. something that I want to emphasize is that I encourage people to take 1 hour per day with spending time with just them. I don't care if that's a bath, a walk, but spend 1 hour a day working on you in some way, to bring down that stress level. Because we as women in particular, we give so much to others and we don't do enough of taking care of ourselves.
So true. So true.
I agree. I think Susan and Treva, you guys touched on some things. And I think all of us kind of fell into one of those categories of not knowing their boundaries or taking on too much and not worrying about self. And I think that knowing that and making it aware makes people realize and think like, maybe that's why I'm stressed, because I don't know my boundaries, or I do take on too much and I want to get it all done, but I don't have the time in the day to complete every task that I want to. So that makes it very aware and real, and it helps people understand, hey, this is why I might be stressed. So with that being said, why is well-being and mental health so important for children's development?
I guess I'll start with that one. Children, first of all, they're hardwired to deal with, born with certain type of emotions. We all know sadness, joy, disgust, anger, surprise, and fear. The other emotions that a lot of children have to deal with need to be taught by their family. In particular, they need to talk about cooperation, sympathy, empathy, gratitude, being optimistic, and they need to form these attachments from their parents to get these foundation skills done. When you have hectic work schedules, it's going to interfere with healthy type of attachments that foster children's self-esteem and sense of mastery of the environment. And our children aren't getting that from their family members. So when they go to school, they have lots of problems because they didn't get that development at home. And we see it a lot because children don't get the practice. Parents are working different shifts. So some children don't even get to spend quality time with their family members to work on these skills. Good mental health helps children and develop socially, emotionally, and physically. And our children are missing this. And it's been detrimental in the classroom.
Yeah, I think that's really important what you said there, Treva. And I used to say to my kids, I was your first teacher, and I'm kind of an always teacher because I'm your parent. And as soon as you were born and you were given to me to begin to nurse, or just those early moments, I am immediately put in a teacher role. And so I think it's important for parents to learn that they are teaching. They're always teaching, and they're teaching when it's nonverbal and they're teaching when it's verbal. And, I'm no expert in all those areas. I'm still learning, best ways to teach and learn for myself. But I think that it's significant to pay attention to the fact that parents are showing and advising without or with not knowing it. So sometimes behaviors of a parent might play out to the child, might put them in a frame of mind of fear or less success or whatever, or maybe a parent's not tuned into education as a high standard need for one of their children. So the child may not value that educational view as much either. So I think, again, back to awareness, back to acknowledging that as parents, we're always teaching verbally, non-verbally, directly, indirectly. And then as the world broadens for our children and they do go to childcare and they do go to school and have friends outside of the family system more and more and more, I think all that teaching takes place, good, bad, not so great. It can take place in those environments too, but it always comes back, I think, to home to say, what are the things that our kids, what are the values we want them to have instilled in them? And how can we keep reiterating that for our children? I think that's all very true. And what we find too in the field of counseling is that oftentimes we are working with the parents more than the children, because the parents are learning how's the best way to manage this issue with my child. And once the parents begin to manage it differently, the child's anxiety or the child's behavioral issues begin to calm down many, many times. So again, that goes back to learning and continually being open to the opportunity to learn. And we also, historically, we drag with us whatever we learned in our own childhood, in our own family of origins. And as we bring that forward with us, it's important to analyze, do I need to keep doing this way? Do I need to continue what I was given? Maybe we inherited some great parenting skills, some great ways to interact with our children, but maybe we didn't inherit all good things. And we have the power, we have the choice to say, I don't want that in my child rearing experience with my kids, or I do want that, or I want to emphasize this more. So just again, back to awareness, back to learning, back to openness.
Because children are like magnets. They pick up even when we're upset, and they carry our trauma sometimes. And so that's why we really have to deal with some of the issues that we've had in our lives, because it carries over. We have generational problems still continue to go on because they haven't been addressed by the parent.
And
I agree.
We'll all make mistakes, right? We all make mistakes. And I think that warrants forgiveness. And, I love the saying, and I'm beginning to learn to live with it. If something didn't go well, consider how you can begin again. You can always start over. You can always begin again. And I think that's powerful to me anyway, because when I've done something in a way that isn't stellar, I say to myself, well, I can have a do-over. I can begin again to learn that or to do that differently the next time. So self-forgiveness, self-awareness is also key in that area too. But I think Treva's right. It's like a compounded historical way of life that we often bring with us. And somewhere we have to pull out some of the stops and begin to explore what else is possible.
And I think that's where it's important, where employers allow their staff to have those mental health days. I believe in mental health days. I'm a therapist, and I shouldn't have to tell anybody why I'm taking off if it's a mental health day, to take care of myself.
Yeah.
I've come from some environments where that wasn't allowed, the mental health days. It was work, work, work. And that caused a lot of stress, within the organization. And I think that's key, that for employers to allow their staff to work on themselves, because when they are a better person, you're going to get better productivity out of them.
Absolutely. And better retention.
Yes.
And I think we hear from the healthcare workers, and you all know on this call that healthcare is really being challenged in the arena of the last couple of years. And I think we hear from healthcare workers, I'll feel so guilty if I take off, or if I take off, then so-and-so might have to pick up my shift, or, this patient, is in such a need and I've really gotten close to them and I don't want to be off for a day or two, or, but we have to find, I think Treva's right, the balance to be well ourselves in order to give. We have to fill our own cups. We have to put on our own oxygen masks first before we can help somebody else. So it is so key to take the time that we need to be well. And physical wellness is equally important to mental wellness. It's mind, body, spirit. It's all in there together and important.
I agree. It's so important for caregivers to consider their own mental health needs as well as the needs of their young children in their care. Good mental health is an important part of a healthy child development. It helps children build positive social skills, emotional behaviors, and their thinking and communication skills, which start at an early age, of course. And so that trickles down to us as adults. How did we handle that when we were younger? How did our parents handle those things? So I think it's a lesson learned for everybody. I think everyone might have to reevaluate some things after today and figure out, what can I change to benefit my children, or what's impactful for my child. So nonetheless, as I stated earlier, how can we let our employers know that childcare is not just a family issue, but also a business issue too?
I can begin. I think employers, when they realize that childcare is often creating concerns for families, it might be that they're late getting to work because the childcare situation, they need to talk to the childcare provider. They needed to explain a medication that the child is taking. Whatever might happen in that instance, they might be running late for work. They might, so that might impact the employer. They may not be able to come into work because maybe they have a private childcare provider, or a situation where there's low staffing and the childcare provider can't be available. Again, from the employer standpoint, recognizing these are real factors. And I do think most employers, they're people themselves, right? So they've had these kind of issues in their lives too. And being able to be flexible, knowing that this impacts all of us. I mean, it's a universal issue. I think the other thing from an employer standpoint is being able to adjust where adjustments are helpful. So somebody might have a need to take their paid time off. And truly, I think it's good to take it off for vacation time if you can, or just staycation time away. But sometimes you have to use it in the moment because, and I think just making that known that that's what it's there for. That's why we have paid time off. We have sick days, et cetera. So I think it's key for employers to keep that conversation open, and for employees to also keep people tuned in to what's going on with them. So those are just some of my initial thoughts.
This is kind of personal, for me, with our organization. Due to COVID, this hit our organization hard more than anything. We are an educational institution, and think of it, most parents think of school sometimes as the babysitter, right? Because they can go to work during those hours. So due to COVID, our staff as well are needing more childcare. And it's made our organization look at what can we provide for our teachers and staff at Anderson Community Schools due to COVID, and they need more flexibility. Think about a teacher. There's very little flexibility because if they don't go to work, who's going to teach the kids? And they have children, themselves at home that they need to take care of. And so that flexibility, that's why I was stumped on that one. That flexibility and being able to find substitutes to come in and help our teachers. There's a shortage teacher-wise, so but working with them as much as possible. Virtual helped us a lot, teaching our kids virtual, because our staff could be at home, with their children as well and teach their class. But we can't stay on virtual and forever. Studies have shown how that's impacted children. But if an organization can be as flexible as possible, childcare on the premises. I've worked at one organization, the Excel Center, and we had childcare for our staff and for our students as well. I mean, that's going to be very helpful, but that's a tough question. Yeah,
I think childcare on the premises that's amazing when that's available, and it gives the parents so much mental health satisfaction, because they can drop in at lunchtime, check on the child. If they're nursing, arrangements can be made for that kind of bonding time, I think that's an incredible solution if employers can consider that. I think from the employer side too, I think that retention is impacted when there's more flexibility. I think, again, job satisfaction is impacted. People who like their job and they feel their employer cares about them tend to feel better about coming into work. And I think it's also a recruiting opportunity, to let people that are going to be hired know that we've got some flexibility here. We've got some availability for a room for change if that comes your way. And all that does impact what we call presenteeism in the workplace, that people are more present. I mean, you can be at work, but be 100 miles away in your own thoughts and not even be focused on what you're doing. But if you have good resources, mental health support surrounding you, your presenteeism, your ability to focus is much more prominent. The other thing is the more present you are, the less safety issues that arise, because when you aren't focused on your job, what happens? Accidents, errors, missteps, things that need repair then. So that sets the organization at risk, and it sets the individual at risk and those that they're caring for or working for at some risk. So that's so important, I think. And I think that as people love their work and appreciate their employment, they want to come to work. And that's great energy that increases that, Treva mentioned productivity. It improves performance. People want to shine. They want to do their best for their employer if they've got things in place that give them that energy. And I think people have so much work-life balance. I feel like I'm in a period of my life caring for an elderly parent where my work-life balance is kind of messed up, right? So I have a lot on my plate at work, but I have a lot on my plate when I'm not at work. So finding areas, little pockets of balance for yourself, I think can be so important and give you what you need as well as your employer. So yeah, it's just important, I think, for employers to be invest in those commodities that are most important, and it's your people. It really is. And that gives better outcomes for everyone.
Can I add something else too? I know a lot of employers aren't going to allow to hear this. They don't want to hear this, but the cost of childcare is so expensive, and to get good quality childcare and what most employees are making, they cannot afford good quality childcare. There is a disorder I call broke-itis, which causes stress when you don't have the funding, to do things, take care of your basic care. That causes major health problems. And when you can't provide adequate childcare for your children, that causes major health problems. And most employees can't afford childcare.
The financial,
they don't make enough financially.
You're right. That is so true. And childcare become more affordable because I think the cost of childcare, it's expensive to provide childcare, but the more situations that we have that can supplement childcare funding and costs can be so helpful. And I'm so glad childcare answers is there because, it's helping fill a gap that has existed. And I think it's phenomenal what you're accomplishing in the, the reality of today, for sure.
Well, thank you. So yeah, just leading into that question, Here at Child Care Answers, we do offer consultation with leadership and HR on how to implement those family-friendly policies and benefits, such as a child care subsidy, such as tuition assistance, paid leave or flexible schedules, one-on-one consultations with one of our employees, help developing and administering employee surveys to understand what's the need in that organization. Our offerings enable organizations to have a positive impact on hiring and keeping that top talent. The job market is extremely crazy right now. And so meeting the needs of those working parents enables people to boost recruitment, enhance retention, and reduce the absenteeism. So if there's anyone on this series today, if you guys feel that, your employer might need someone to talk to help see that this is just, this is also a business issue too, feel free to message me or email me. I do have the last question that came in our chat, ladies. And let's see. That came from Joanna. Thank you, Joanna. The question is, do you think parents are more hesitant to take their children to childcare because of COVID?
I do. I think there's been some hesitancy there. And, in the state of Indiana, of course, we're at a certain point with vaccinations and such, and children more recently can get vaccinated. But I definitely know, I personally had somebody working on my team who opted to go to practice because of that very issue. They were afraid to take their child anywhere because of COVID. And it's worked out for them. It's a real balancing act, I think, for them. But that, I think there's many examples out there that might speak to that. I don't know, Treva, do you have any other thoughts on that?
I definitely agree. That fear is real, is very valid. We have a lot of students that won't even come to school. They're staying on virtual due to family members afraid of catching COVID. You have grandparents that are help raising some of these children. So they have that fear there, taking their children to child care in other places. It's real because people are dying. So I think it's very valid.
I definitely agree too. COVID it's shone light on so many different things. And it's honestly, I don't think it's going to go away. And so I think we have to take the next steps to kind of get over that fear hump. Yes, people are passing away. Yes, COVID is creating different strands, but at the same time, we can't live in fear sometimes. It's fearful, yes, but I think we have to take the initiative and the steps, getting a vaccine, getting the necessary steps to help prevent those measures of getting COVID. We did get another question. Do you think that childcare providers eventually will be mandated to get the COVID vaccine?
I don't think it will in the state of Indiana.
I was thinking the same thing. I unfortunately don't know that will happen for our state, but to me, it seems very valid that it would be reasonable. Of course, IU Health took an early stance that all healthcare workers need to be vaccinated. And no matter what you think about that, I think that they took that stance because the responsibility to truly care for our patients in all ways. And we don't want to be the carriers of an illness that they're in a vulnerable space to catch. So I kind of see that as equal to childcare providers. We want to put our kids in environments that feel safe in all ways. I think of the flu vaccine as being an example. I don't know that that's required, but it's highly recommended. But it may have less overall worldwide impact at any given time compared to COVID's seeming variations, as you said, different strands, different types of COVID. So yeah, I think it would be wise. I don't know that it will happen. I don't know if there's advocacy available to impact that if people think that's how things should go. But it would give parents a better state of mind, knowing that their kids are in an even safer environment.
Okay, I have one last question. I apologize. But awesome. I'm glad that people are asking questions. What age-appropriate self-care techniques can parents teach their children so that kids can learn to take care of themselves and lessen their own stress?
Some things that I use, with little kids, it's hard to teach little kids how to do self-breathing exercise, but we've all seen bubbles at the dollar store. And that's how I teach children as young as 3-year-olds to start taking deep breaths, because they all like to blow bubbles. And what they do is hold their breath in and they blow and stomp on the bubbles. And I start with children as young as 3. Another technique that I like to use with young children as well is I make them hold themselves like a pretzel. Kids like to even sit on the floor, like a pretzel. And we work on exercises that way, just so they can get some self-control of their own body, of what's going on. We teach young kids even as young as 5 years old how to do yoga. And we do it on the floor. We make it fun. There's all kinds of fun videos that are free, to do that. I believe in movement breaks in the classroom that I utilize a lot. I even get with the older kids, we do push-ups on the wall. There's all kinds of videos. There's so many resources out there that we can use. And to get kids doing that, I always tell them I need a break. And so they like to do, what I do. So, and I don't think we do enough of that. So I even teach the teachers how to do breaks, for themselves, to let them know that this is something healthy to do and they want to model after us.
I love that. And I think that that's a great example of how an adult, including a parent system, can model for kids and inspire kids. I think sometimes, like in the morning rush, getting your kids out of bed in the morning can be really challenge getting everybody going. And if you say to your kids, hey, in 3 minutes, we're going to dance in the living room, or in 3 minutes, we're going to do some stretches, or I need to do these, as Treva said, and I want to do them with you. I think that's a family experience. Kids like to spend time with their parents and their caregivers. So I think that's very wise advice. But I think make it fun, but also try to be those role models to get up and walk. And it's the same thing with childhood, weight issues and things like that. If we can model some of those behaviors, it's going to help in the long run, and it's going to teach those skills for life. Eating nutritious foods, et cetera, et cetera. It's kind of all the same.
Thank you, ladies, so much. I am going to display our next upcoming series, part 3 and part 4, for January and February. Feel free to go to our website and you can register by looking at our event calendar. If you have any questions related to childcare, feel free to contact us here at Childcare Answers as well. Well, thank you all. Have a great day.
Thank you.
Thank you. Thank you for the opportunity.
Thank you.
Nice meeting you, Susan.
Yeah, you too.
It was wonderful. Great.
Take
It was
care.
wonderful.
Well, thank you. Take care, everyone. Bye-bye.
Bye.